It is now 7:46. Thanks for joining us here on Good Day Gulf Coast on this Monday. Fox 10 News is committed to keeping you safe, and we are tracking the coronavirus case by case across the U.S., keeping you informed should anyone develop symptoms in Alabama, because currently nobody has that in Alabama as far as we are today. So joining me today, we do have Dr. William Admire and Georgia Kane with Infirmary Health to talk about prevention and treatment and what the hospitals are doing. Good morning, y'all. Thank you for being here. All right, let's start with the basics. So y'all are ready should we have a case, and we're assuming at some point we will, right?
Correct.
Okay, so what are we doing to be ready?
So we have an emergency management plan, and within that plan is an influx of infectious patients that are guidelines from the CDC.
So the CDC standards are what we're looking at putting into place when we have something happen here.
Absolutely.
Okay, so are we ready?
Yes, we are. If patients arrive with symptoms clinically of upper respiratory with fever, cough, shortness of breath, we have a management plan in place where we'll test them based on CDC and Alabama Department of Public Health guidelines.
And so those are the symptoms that you look for. So when somebody comes to the hospital, say, or somebody comes into the emergency room and they say, I've been traveling, or I know someone who was traveling, so immediately there's a protocol that goes into place?
Absolutely, and the first thing we're going to do is put a mask on the patient, and that's to protect everybody around them.
And when you talk about masks, we've been hearing that it's not something that people who are healthy need to be doing. Is that something that y'all think?
I think you're right. What we're looking for right now, we know that the coronavirus makes people that are older, the elderly, more susceptible, that have chronic diseases such as diabetes, heart disease, lung disease, are immunocompromised. They're at higher risk for contacting the disease and develop severe symptoms. So they're the ones that we're really watching closely.
And if somebody does get sick, there are some things that we can do to protect ourselves, right?
Absolutely. So hand washing, number one. Always wash, wash, wash. We can't say that enough. If you're around somebody or if you start coughing or sneezing, use your elbow to cough to keep the spray from going. Or if you use a Kleenex, cover it, but then again, wash, wash, wash.
One of the important things I want to say is don't panic. Be calm when something like this happens. It's a public problem right now, globally. We know that we have over 500 cases in the United States, maybe 22 so far reported that have died from it. But the main thing is you want to be social isolation. If you're sick or you know someone else is sick, keep your distance from them 6 feet or more. If you're coughing, cough into the crook of your elbow. And if you have symptoms of fever, upper respiratory, or shortness of breath, call your physician. They will give you instructions on what to do. So
you recommend we call first instead of just showing up? Potentially, because we could be carrying something that's very contagious?
That's correct. You don't want to have a huge surge of influx of patients to the hospital or the ER, because all you're doing is exposing others to the disease.
Yeah, that makes good sense. And this is one of the things we talk about all the time here at Fox 10, how we are presenting this. Want to make sure everyone has the information. And one of the things that we're talking about, no cases in Alabama or Mississippi, but we are expecting to see this continue to spread.
Yes, I would expect that Alabama eventually will have a positive case. They do not right now, but we have the ability to test, but we're using the criteria. We're not just testing everyone. They have given us travel advisory alert, people that have traveled, and what symptoms to look at to test people. And that's what we're doing right now.
And as far as this coronavirus goes, this is something we talk about, coughing into the crook of our arm and that kind of thing, because it's contagious that way, right?
Correct. It's droplets, so it's the same as the flu. So if you're coughing and sneezing, it's just spreading. So that's why they say the 6-foot distance from anybody. And being able to stay at home, because there are things that you can, even the flu, you can treat at home based upon what the guidelines your physician gives you, treating fever, staying hydrated, those things. What
about surfaces? So if somebody has this and we know that they have it, how should we clean up after them?
I could say that most disinfectants with alcohol-based or bleach-based, you can wipe a surface, and that will get rid of the virus. Okay.
And so we've been hearing a lot about travel today. We heard this morning that they're saying cruises may be a little iffy. What recommendations do y'all have for traveling? I guess because that would be in contained spaces with people for a long period of time.
The latest from the CDC and Dr. Fossey from the National Institute of Allergy and Infectious Disease if you're elderly and have a chronic disease, it is not recommended to go on a cruise.
Not recommended
Not
to go on a
recommended.
cruise. So those are the things that we're talking about, the elderly or those with underlying conditions.
Yes.
Because we've been hearing about how many cases there are, and that's who we've been hearing have they're in the most critical condition because of this disease.
Yes. We must remember that the majority of people, the supermajority of people, have mild symptoms and can take care of themselves at home. If you develop worsening symptoms, higher fever, cough, shortness of breath, you need to get medical attention right away. And then that's when it becomes severe, and there's no medication for the coronavirus. It's a virus. So what we do is give supportive care and get you through the symptoms. There's right now, globally, they think that approximately a 3% mortality rate, but 97% will make it through.
And the good news too is that our local hospitals, y'all are ready, our healthcare systems are ready. In the event that this does come here, y'all are ready and prepared for this.
Yes.
Yes, we are. Today we're having 3 meetings alone at the Infirmary Health System regarding the coronavirus. We're informing our physicians, our nurses, administration, and all our staff and employees, nursing, what to do, how to handle this if we do have cases that develop in Alabama.
Very good. Y'all, thank you very much. Thank you for what you do. Thank you for keeping us all healthy and being on top of this. All right, thank you very much. We're going to continue to follow the coronavirus as this story continues to develop. It is now 7:53.